Thank you, Chairman. Thank you, Sheila. Chairman Northam and committee. My name is Andrew Rose. I'm a pediatrician practicing here in Cheyenne at the Cheyenne Children's Clinic, and I'm the current leader of the Wyoming chapter of the Academy of Pediatrics as well. But so first of all, thank you for listening today. The importance of this issue, I don't think, can be overstated at all. We here in the state of Wyoming are definitely in the midst of a epidemic of pediatric mental health. You guys have, I'm sure, heard and know, and possibly have experienced yourselves. And so I'm here as a primary care pediatrician pleading for help and caring for these children. These young adults and children are suffering, and it's really quite difficult in Wyoming to recruit the specialists that are needed to assist us in this fight. And really this gives us that tool. It will allow us to do more with those few that we are able to have here. And eventually what we hope to do is to use the one or two child and adolescent psychiatrists that we do have to kind of work as a hub, and then myself and other primary care pediatricians and family doctors can work as the spoke and really create this or sort of spread this to further reaches of our spread out population. And honestly, I mentioned child and adolescent psychiatrists. JJ will go into this further, but they're like unicorns. They're really hard to get these specialists here in our state. In fact, they can practice wherever they want. And just to be brief, sorry, as others have said, this method of delivery of care has been proven. The outcomes are, we have great, randomized controlled trials that prove depression rates are lower. And I think what Sheila is talking about also, the cost effectiveness is important to mention as well. We're going to decrease use of expensive ERs, of hospital stays, but most importantly, it will be really crucial in saving lives. Lower suicide rates. That's our primary. I would say our sort of ultimate goal. And so, with that, thank you so much for your time.
Thank you, Andrew. Anybody got a question for Andrew? Thank you.
Mr. Chairman, good afternoon. My name is Jasper James Chen, JJ for short. I am very, very grateful to have gone to medical school with my colleague, Dr. Rose. We're both graduates of the WWAMI program. We came back to Wyoming to be able to have our loans forgiven after 3 years of practicing here. My wife and I, my wife is also a WWAMI graduate. She's a neurologist. Now, we've been staying here for almost 9 years. And so we are tremendously grateful to be part of a state that honors the retention, recruitment of physicians to come back to the state, because it's exceedingly difficult.
Well, thank you.
My wife, well, thank you, sir. I'm very, very grateful. My wife, if she had her choice, would have stayed in Seattle, where I'm from and born and raised. I convinced her not to go back to Rock Springs, at least. So we're here in Cheyenne. So we're very, very grateful. As Representative Zvanitzer already said, the collaborative care model has been around. It's relatively new, as he said, but it has been around for a while. It was developed at the University of Washington. And it's an incredible opportunity for collaboration between mental health providers and pediatricians and primary care physicians. In all honesty, when I first started practicing at Cheyenne Regional Medical Center, where I'm currently an inpatient psychiatrist, I had the opportunity to work one morning or afternoon a week within the confines of neurology in the outpatient setting. Also, we had the opportunity to go to life care, some other skilled nursing home facilities, to be able to kind of just go to where the patients are. And that's the simplicity of the collaborative care model. As you know, there is a huge stigmatization for receiving mental health services here nationwide as well. When folks come to my office, they have to park their cars outside. People know what we drive here. It's a really small place. And so you just want to have options where it's a little bit more discreet. If folks are just going to their pediatrician's office or their primary care physician's office, and if something is urgent enough that Dr. Rose or one of his colleagues identifies as requiring more immediate psychiatric input and evaluation, at some point we would build into the model the capability of seeing a patient right then and there, instead of having them go all the way across town to another building or something to be seen. Furthermore, the collaborative care model allows us to have active oversight of the most acute and active patients to be presented to us as the specialists in mental health. We wouldn't need to review every single person every single day, but on a maybe weekly or a monthly basis, we'd be happy to help guide the care that's already being furnished by the expert pediatricians and family physicians. The vast majority, I would say, of things that come initially for concerns of mental illness such as anxiety and depression can be safely and adequately managed and optimally managed by primary care physicians and PCPs. If you ask my patients who come see me, either in the outpatient side or, God forbid, if they're hospitalized and they will really see me, what their preference is, I would say the vast majority of them say, I would rather be seen by my primary care physician or my pediatrician. And this is what the collaborative care model really, really does. It allows an individual to stay within the medical care primary home. And that is the best and most comfortable place for an individual to receive healthcare. Mental health is no different. Patients need to be comfortable. If at some point it is more increasingly difficult for my colleagues in pediatrics and primary medicine, primary care to see a patient, they will absolutely refer this patient to me on the specialist side. They will then come to my building and then be seen at behavioral health. So there's a certain category of patients that absolutely benefit from the collaborative care model. Now, we've been trying to do the collaborative care model regardless of whether we're getting paid for it or not. But I offer this as a wonderful opportunity to recruit the finest and best physicians to come here to Wyoming to practice, because Wyomingites are fully deserving of that level of care. I'm happy to stand for questions.
Good job. Questions? Go ahead, Representative Obermuller.
Thank you, Mr. Chairman. Is this voluntary type coverage in insurance policies right now, or how does it work currently?
Go ahead, Sheila.
Mr. Chairman, Representative Obermuller, right now, Wyoming insurance companies are not paying for this. Medicare pays for this.
Oh.
It was the model was established in the early 2000s. CMS designated the 4 CPT codes that are specific to this kind of care in 2016. And so we're in the process of sort of stepping into a space in which we can get all of our insurance companies and our state payers, government payers, comfortable with this model. Part of what makes it so different is currently medicine bills based on one provider billing a code, a CPT code, and then being reimbursed for that. And the way this model works is an entire team of providers, so psychology, psychiatry, primary care physicians work as a team, and they bill the number of minutes that the entire team wraps around a patient. And so the insurance company reimburses based on the number of minutes that the team spends treating and providing care to the patient. And so it's really moving away from what medicine calls fee-for-service, which is what today's world basically looks like, into a value-based care, team-based service. And it really is what the evidence supports being the way the future will look. It's how patients get well faster. It saves a great deal of money in the long run. And so we've worked through the interim with Blue Cross Blue Shield specifically, kind of making sure that everyone's comfortable with this very small step forward. And I think we'll continue to see other small steps. It's not a huge step. And right now we're at a very comfortable place where we don't have opposition from those payers, which we really appreciate.
Thank you very much.
Further questions? Representative Brown, go
I
ahead.
don't have a question, Mr. Chairman. I just need to apologize to Ms. Bush, because as she was testifying, I was busy dodging a light that was coming down off of a badge back here and blinding me. And I feel really bad because I think she was very concerned why I was dodging her. So my apologies, Ms. Bush.
You see what we have to put up.
Thank you, Mr. Chairman. I thought you were trying to not make eye contact with me. And
Okay, any
So
other,
bad.
any other questions? Anybody? Representative Provenza, go ahead.
Just a comment, please don't leave. Thank you.
Yeah. Stay in the state. Okay. Anybody else? Anybody else want to, go ahead.
I'm just still trying, Mr. Chairman, I'm
Go
just
ahead.
still trying to get my head around. So the pushback when we get this